Okay, time is up. Thank you, Dr. Kamal Parvez. Now I would like to
Thank you, sir.
request our next speaker, Dr. Mohammad Shajedul Islam, to come over the dais and deliver his speech on a stunted growth female presented with exertional dyspnea and palpitation.
No, personal. এখানে আছে। শাহজাদুল ইসলাম। প্রেজেন্টার ভি করে দিন তো। প্রেজেন্টার ভি করে দিন। Assalamu alaikum. Thanks IPDI for giving me the opportunity to present here. Honorable Chairperson, respected audience, this is Dr. Shajedul Islam, Phase B resident from Miami Singh Medical College, presenting my case. A stunted growth female presented with exertional dyspnea and palpitation. Miss Runa, 18 years old, female, hailing from Madhupur, Tangail, with the complaints of altered sensorium for 1 day, exertional dyspnea and palpitation for few years. She also have repetitive history of respiratory tract infection since her childhood. She presented with delayed developmental milestone, poor school performance, and repeated history of loss of unconsciousness without having neurological deficit. She is having abnormal short stature with a weight of 18 kg. Her height is 140 centimeter and head circumference is 46 centimeter. And she delivered at 33rd weeks of her gestation at home with birth weight of 1.5 kg. And her parents were first degree consanguineous and one of her siblings suffering from such type of illness. And on examination, there are some anomalies such as zygomatic and mandibular hyperplasia, kyphoscoliosis, sternal abnormality, clinodactyly, mongoloid feature, malocclusion of the teeth and microcephaly. She has receding sloped forehead, low set ears with hyperplastic lobule, beak-like protrusion of the nose, narrow face and receding lower jaw. She having, her general condition was poor, having normal body temperature, heart rate was 88 beats per minute, respiratory rate was 16, and her BP was 90 by 60 millimeter of mercury. On precordial examination, first heart sound was normal, there is wide and fixed splitting of the second heart sound with a systolic murmur over the pulmonary area, having no thrill or sign of pulmonary hypertension present. And other systemic examination reveals no abnormality. So our differential diagnosis was sickle or sickle-like syndrome with atrial septal defect, osteodysplastic primordial dwarfism with ASD, and Russell-Silver syndrome with ASD. In our patient, there is no other bone abnormality except kyphoscoliosis, so the osteodysplastic primordial dwarfism is unlikely. And in case of Russell-Silver syndrome, the cranial perimeter is generally normal, the face is more triangular, and the ears are very small, and mental retardation is less severe or totally absent. So our patient is seemed likely to be a case of sickle syndrome. This is her growth chart. This is the below the normal percentile level. Her CBC was normal. And we have done a lot of hormone profile to exclude the cause for his dwarfism and other endocrine involvement, including the growth hormone, luteinizing hormone, cortisol, and thyroid profile. All are normal. Her biochemical report was normal. ECG shows the incomplete RBB pattern ECG. And her chest X-ray was cardiomegaly with the RV type apex. Her MRI of brain was normal. And we have done the EEG, and it shows normal feature. And then we have done echocardiography. It was little bit difficult to demonstrate the echo dropout in IAS. Then we have done agitated saline contrast echo. We're seeing that the bubble passing from right to left. So dear audience, in spite of doing all this investigation, we have not identified the reason for his unconsciousness. And we think that we are not so far from our destination and we don't want to come back. So what should be our next plan? A systemic review showed that around 3.16% of sickle syndrome presented with CNS vasculopathy, like Moyamoya syndrome, vascular aneurysm, or any vascular stenosis, and their presentation is recurrent TIA, coma, and interestingly, around 13% patient having no sustained neurological deficit regardless of the management approach. So our next plan is to do digital subtraction angiography and genetic study. It should be done in near future. So lastly, the discussion. Sickle syndrome is a very rare congenital disease inherited as an autosomal recessive manner, as it occurs in only 1 per 10,000 children. It includes severe IUGR, mental retardation, postnatal dwarfism, various malformation, and endocrine or hematologic disorder with a typical bird-like faces. That's why it named as bird-headed syndrome by Rudolf Virchow. And it was first described by Mann and Russell in 1959, then by Sickle in 1960. Only a few congenital heart disease have been reported so far, like atrioventricular defect, interventricular communication, complex ductus arteriosus, phallostetralogy, and atrial septal defect. ASD has been reported for the first time in Japanese child, and second one by Arnold et al., and third one in 2009 by Panigrahi et al. And CNS vasculopathy may also be present in few cases. The different manifestation of the syndrome should be diagnosed as early as possible to avoid a poor prognosis, especially death caused by cardiac insufficiency, arrhythmia, or pituitary insufficiency. So, a long ways to go, not only for our academic interest, but also for the welfare of the patient. And we think that all our patients get well in touch of our doctors, just like how the nature enlive in our soul by his beauty. Thank you. Thanks for all.
Thank you, Dr. Shajedul Islam. Now I would like to request our audience, do you have any questions or not? And next I would like to request our...
Where is your ECG? ECG?
Sir.
You didn't show the ECG?
Yes, sir.
ECG দেখাচ্ছিল। So how will you explain palpitation in this case?
Palpitations are patient having palpitation during when exertion. Sir, it might be a cause of decreased it might be, sir. It might be paroxysmal SBT. When on exertion, patient feel sinus tachycardia might be a cause. And patient anemia, absence low. Anemia one of the cause, but patient having no anemia, sir.
So your Dr. Sajed, yes, you have diagnosed a cardiac condition. In this case, diagnosis is ASD.
Yes, sir.
ASD secondum.
Yes, sir.
So ASD secondum is maybe associated with symptoms of palpitation, even if there is no other complication due to exertion.
Now, sir, I'd like to request our Shafi Mujumdar, sir. So, do you have any comments, sir?
ঠিক আছে আমার মনে হয় কোনো কোশ্চেন না থাকলে নেক্সট স্পিকারের কাছে চলে যাই আমরা তো
Okay, thank you very much.
এমনি